Hello, everybody. Hello, and welcome to Preregshortcuts with your boy Marvin here tonight. Very excited to have all of you joining me for a great session. Today, I'm going to introduce to you a whole new way of learning using a different system. We're going to use the system live. And those of you doing the exam in November, or if you're doing the exam in June, you'll totally love this session and you love this new way of learning. So how's everyone doing? Let me just give a special shout out to all of you. Lydia, how are you? Hilditch, great to have you on. Hello, Lydia. Please type hello, give me a shout so that I can give you a shout out before we start tonight. Hannah Blackburn, how are you, Hannah? Thank you so much for typing in yes, and thank you for joining tonight. Jerry, great to see you on. Jerry, great to have you. I'm delighted to have you on. It's been a while. Jerry, I need to get back to you. Sorry, I know I haven't gotten back to you yet, but I have you in mind. Bless J. Edohen, how are you doing? Great to have you. Great to have you. You're going to have a very good time. Basically, I'm going to show you one of the best ways to learn. And let me just ask you a question. How many of you are actually sitting the exam in November? Nada, how are you, Nada? Great to have you on. Nada in the house. Nada Juma, great to have you on. Ishika Patel, how are you, Ishika Patel? It's great to be back. You know, it's been a while since I've done YouTube Live. In fact, I was the one who started doing StreamYards. You could go back and you can even check in the years and years, you see who started this, the original OGs right here. But yes, I'm delighted. Hannah, so how are you guys feeling? So who else is doing the exam in November? So this session today will be very, very useful for anyone doing the exam in November. It's also going to be very useful for anyone who is sitting the exam next year. So it doesn't really matter whether you're doing it in November or whether you're doing it next year. The only difference is we're going to do questions. We're going to do GPhC style questions. And I'm going to go through with you the Preregshortcuts question bank. And the reason why we need to go through the question bank questions is because this year, and you guys could read on our Trustpilot reviews, we have the most Trustpilot reviews, over 280. But the recent reviews and the feedback from trainees, there's a lot of feedback with trainees saying that the questions that came up in the GPhC exam were similar to the Preregshortcuts mock and also similar to the question bank questions. So I thought, let me try and make this easy for all of you. And the way I'm going to do that is by showing you and giving you an opportunity to practice some of these questions. Does that sound good? If that sounds good, type a 1 in the chat if that sounds good. If you're looking forward to practice some of these questions, this is a new website, a platform that was developed specifically for you, for trainees. And it has been designed with the GPhC in mind. So what you're going to see from this question bank, it's not just any random question bank. It's not just a question bank where we just put random questions. Everything is designed to simulate the actual GPhC exam itself, right down to the functionality. And that's why I'm using the platform so you could see. Okay, so lots of ones. Thank you so much. Thank you. Another good thing you're going to have with these sessions, and I'm going to do quite a few of them, is I'm going to give you a choice. Like, we have such a good platform that you could actually choose what you want. If you want to do calculations, if you want to do clinical, if you want to do MEP, if you want to do OTC. I am happy to do any with you, and I'm going to show you the questions. We have a timer. So all of these sessions will be done under exam conditions. Shirin, how are you? Good to have you on. Hannah, are you ready, Lydia? Are you ready, Lydia? Are you ready, Moon? Are you ready? Simon Abibi, Marvin the Great. Some of us get our results after the 30th of August, and will be nice to extend promotional offers. Of course, Simon. By the way, I'm going to put a link, because there's certain things that it's better to chat or talk about it. If you want to speak to us, we actually have a direct line. Calendly, you could book a Calendly call if you want to talk about the program, enroll on the program. I've just put the link on here. You can literally book a call, and a member of our team is going to call you and discuss any queries you have. Okay, so are we ready to test ourselves? So I'm going to test you directly from the platform. And once I put the questions on, I want to make sure, what do you guys want to do? Should we start off with clinical? Because I think I'd advertise clinical. I advertise it as high weighting chapters, but I could do anything. We could do calculations, we could do MEP, we could do OTC, but let's go clinical because that's my forte, right? Okay, let's go clinical. And then if you want, we could also do some MEP. We could just have a mix of questions, right? If you guys want that, we could do that. So the Preregshortcuts platform is so unique. And the reason why it's so unique is because we have a platform that is all in one. So you have everything in one place. That's the whole purpose. So you don't have to get your mock paper over there and get a calculations course over this other provider and get clinical in another provider. You literally have everything in one. So what we're going to do today and for the next sessions is we're going to go through the question bank. Can you guys all see the question bank? Has that changed? Type 1. I want to make sure you could all see this. So we have a choice. We could either go through calculations or we could go through clinical mixed, which is OTC, MEP, BNF, or we could just do therapeutic chapters of the BNF if you guys want. Or we could do MEP, or we could do OTC. So this is a new way of doing things. We always try to be innovative and to bring you the best and the most innovative technology. And I'm so delighted to say today we have one of the most innovative technologies there for you, which gives you more options, more choice. Okay, so clinical, I'm going to go for Simon because that's the same name. My dad is called Simon. So I've got a very strong connection for Simon. So Simon, you are the winner. We will do clinical, and then we may also think about Nehita, because Nehita sounds like a very lovely girl. So Nehita, we may also do some MEP just for you, Nehita. Does that sound good? Fantastic, guys. Let's do this. It might last about an hour for this session, but I promise you're going to get so much. So here are the rules of the game. The first thing, in order for you guys to pass, and I'm going to give you so many tips that are going to help you for the GPhC exam. I've been doing this for over 10 years. And the pass rates, success rates with Preregshortcuts is phenomenal. So here's the first tip I'm going to give to you. The first thing you want to do from now on is you want to do every single question under timed conditions. This means every single question you do, with calculations, we're going to say 3 minutes. And with clinical, we're going to say 1 minute. The reason is because if you start timing yourself now, you have a higher chance of doing well in the exam because you're not going to run out of time and you're going to have extra time to go over the questions. And story, I had one trainee that failed the exam twice. And during those 2 times the trainee failed the exam, I asked them, why did you fail? What happened? They ran out of time. They always ran out of time, especially with SPC questions. And so we did a few changes. And the only thing I made them change is this. I said, from now on, you have your exam coming up in the next couple of months. All I want you to do is, in order to get a new result, you need to take a new action. Right? New actions produce new results. So here's what we're going to do. I want you to time yourself each time you do any question. 1 minute for clinical and 3 minutes for calcs. If you can do it less, even better. That's all we did. We didn't have to change much. I said, that's all I want you to do. Guess what? Within a couple of months, that's all this trainee did. Timing, questions, timing, questions, timing, questions. That's all they did. Guess what happened? Went to the exam, final attempt, totally smashed it. They didn't only smash the exam, but they finished the exam way before everyone else. And the only thing that changed is because they were practicing every single question under pressure. So today what I have for you is we're going to do every question under time conditions. Some of you may find it a bit difficult because some of the questions in your exam may take longer than 1 minute, as well as some may be shorter. But the pressure you're going to have today is I'm only going to give you 1 minute. We're going to have a timer like the GPhC exam. And I want you to finish that question in 1 minute. Now, don't put your answer down. We're going to do 10 questions, and you want to score 70% if possible. Right? So it doesn't matter if you don't get 70%, but that's our target. Okay, so I'm going to go through 10 questions. At the end of those 10 questions, we will go through the answers. And then I'd like you to mark yourself. And all you're looking for is you're trying to hit the 70% mark. If this sounds good and if you're ready to go, type a 2, type a 2, type a 2, type a 2, type a 2. Pharmacist 007 sounds like a James Bond pharmacist. Practicing under time conditions is key. Wow, and keys in capitals. It will help you make decisions quickly. Thank you so much for that. Thank you, pharmacists. Really appreciate you sharing that because this is what makes a difference. Especially if, say, you failed the exam the first time, please do this and you'll notice that you'll be a lot better the second time. So I'm obviously going to take my screen off because I know it looks a bit small for some of you. But let's go through, let's do clinical therapeutics. So is that good? We said clinical, right? So all you have to do on our website, you select clinical. That's how easy it is. By the way, ignore this result. I did not score 0%. This was just random testing. But here's what we're going to do. How many questions do you guys want to do today? Right, so this is the difference. We're going to interact so much. How many questions do you want to do today? How many questions do you want to do? Just let me know. Do you want to find 120? Gosh, we're going to be here for at least 2.5 hours. Okay, let's do 10 questions. Does that sound good? Sophia, 50 is quite a lot. I don't want to take too much of time. We're going to have, it's better that we do fewer questions over many sessions so you're not too drained. Okay, so let's say we're going to do 10 questions. Is that good? Cool. Let's start with 10 questions. Okay, let's start off with 10 questions. All right, so all you have to do is high weighting. Do you guys want to do high weighting, low weighting, medium weighting? So 10 is great. Hannah is realistic. She's like, yo, come on, guys, be realistic. I need to chill and enjoy my dinner tonight. Okay, so so 10 is realistic. We're going to go 10. Harris, perhaps next time we're going to go 20. Then I'm going to make it longer. What do you guys want? High, low, or medium? Okay, let's see what we've got. Hannah says high. All right, high, Sophia, high. So we're going high because everyone has got high. Let's do high. This is how cool this is. This is new. No one does this. No one does this. Okay, so we're going to go high and we're going to go for 10 questions. Let's go 10 questions. Now, I want you guys to choose how many minutes do you want to do in each question. I say take a minute. A minute is better for practice. Do you guys want 1 minute or 2 minutes per clinical question? Some of the questions will be challenging. Right, this is a reflection of the GPhC exam. Some will be so easy, straightforward, but there may be some that may be challenging. I don't know what's going to come up because we have over 1,000 questions here. We're going to do 1 minute. We're going to put the pressure on. We're going to get ready. So we're going to go through 10 questions, ladies and gents. 10 questions under time conditions. You've got 1 minute to do the question. If your 1 minute runs out, you cannot do the question. Don't worry. Move on to the next. We're going to do all 10 questions, and then at the end, we're going to go through the answers, okay? So you don't need to put your answer down when you have an answer and go, oh, yeah, Marvin is A. No, right? It's not a show of knowledge. It's just keep it personal. Keep it personal, right? And all you're doing is you're aiming for 7 out of 10. Then you're in a good place. Okay, let's go. Right, we're going to go 10 minutes, which means you have 1 minute per question. Are we ready? If you're ready, type a boom. We are bringing the hit. Preregshortcuts in the house tonight. We make it different. We make it new. We bring the innovation to pharmacy. So are we ready? Type a boom. Type a boom. GPhC conditions. Time yourself. 1 minute per question. Go for it. Go for it. Go for it. Right, so these are all questions that are similar to the GPhC exam. We're going to start our quiz right now. Question number 1, you are ready to start your exam. Boom. Start now. So that's your timer, and it's going down. I'll do this way because I don't think all of you, I wanted you to see the timer, but probably not for extended matching questions. Okay, it's fine. I'll take my screen off. It might some feedback. How did you find these questions? Can you guys still hear me? So how did you guys find the questions, ladies and gents? Did you find them difficult? Did you find them very easy? How did you find these questions? Hard? Some were long-worded, I guess. If I get 70% lol, I haven't gone into full revision mode yet, okay? Meh. How does that meh? Yes. Right, so I'm expecting, personally, I was expecting you to find them, number one, perhaps long, perhaps not enough time, average. So let's go through the answers, easy and hard. So it's going to be a reflection of the exam. You're going to have some easy questions and you're going to have some challenging questions. How do you think you've done? Type down what you think you've got. Out of 10, just write down what you think you've got. 4 out of 10, well, it's 9, isn't it? So just put 4 out of 9, 3 out of 9, 5 out of 9. We're going to go through the answers now with the feedback, okay? So just put your answers down. What do you think you've had? So all we're going to do is we've done 10 questions. You answered 0 questions correctly because I was hardly answering. So that's how easy it is. So once you have all your questions answered, just like the GPhC exam, you go through everything. You could always look for feedback. And if you think you're happy, we're going to then submit everything. Oh, you know what? I think I've not answered questions. So it's telling me, hey, you've not answered many questions, sir. Okay. Let me look at the answers it has. So question number 1. Let's look at question number 1. Let's see what it's given us. So question number 1, for each of the following drugs, select the most appropriate reaction from the list above. Has to be below, right? The list below. Each option may be used more than once. What did you guys go for in this one? What was your answer for this? What did you guys go for? What did you go for with this question? What was your answer? Pancreatitis. So all the answers I'm going to show you, all of them are backed up. They're up-to-date answers, and they normally have explanations as well, just to help you. So those who have put pancreatitis, well done. So the correct answer is obviously pancreatitis is the last one. And sitagliptin can cause acute pancreatitis. So if you have any pancreatitis or signs of pancreatitis, abdominal pain and all this with these drugs, you have to actually discontinue the drug. Right. So those of you guys have put pancreatitis in your exam, and I'm going to show you guys later, you definitely need to know your side effects, but not of all drugs, but certain drugs, especially your high risk, your anti-diabetic drugs. But I'll show you guys which ones you guys need to know. Okay, so most of you got this, which is quite impressive. Very good, very good. You're getting ready for your exams. You're looking good. Okay, so we got the first one correct. Fine. Let's see about the next one. Let me return to my feedback. So let's go question number 2. And I think question number 2 was the one we skipped. We didn't do number 2. Or did we do number 2? Let's see. Yeah, that was an SPC. Yes. So what did we get for this question? What did you guys get for question number 2? Antidote questions. You always get antidote questions now. Lots of questions on anticoagulants. So what did you guys get for this one? Andex standard alpha. Great. It's come up a few times in the exam. It's an easy one. We're going to have a little mix. So andex standard alpha, you see that and go, yes, that's fine. You need to know all your antidotes, especially for your DOACs. They tend to come up a lot. Okay. So rivaroxaban, andex standard alpha, we have all of this on the notes. Explanations are all on there so that you know which is which. So protamine sulfate, heparin, some people get that confused. Vitamin K for warfarin. And you have answers that give you details about every single thing. So it's not just, hey, this is wrong and this is correct. You're going to also have a full explanation. Okay. Also know about your tranexamic acid. It's an antifibrinolytic agent. So, but does not reverse anticoagulant effect of rivaroxaban. Okay, great stuff. Let's go to the next one. So I think the third one was the one we had to move on because he had SPC attached to that. Okay. Now, what about question number 4? What did you guys get for this one? Question number 4. What did you guys get? So 55-year-old male with pulmonary hypertension is prescribed sildenafil. Always watch out for certain drugs like sildenafil. They tend to ask those questions, especially interactions with other blood pressure tablets or alpha blockers. Watch out for these questions in the exam. In this case, the patient is taking a monohydrate and experiences severe headaches, dizziness, and flushing. Low blood pressure. What did you guys get for this? I've got nitrate-induced hypotension. Interesting. Induced hypotension. I still remember the memory trick, Marvin. Remember the memory tricks for this question. Oh, I think you're talking about the DOACs, is it? With the undexanded alphas. Yes, we love our DOACs. We have very good notes on DOACs. Really good notes. Okay, so explanation. The correct answer, sildenafil. If you put sildenafil and nitrates interaction, well done. Right, so we all know sildenafil is a p-phosphodiesterase type 5 inhibitor. They tend to ask you these questions, especially in terms of reducing blood pressure. And they want to know that you know which drugs interact with them, so that if you're doing a service in your pharmacy, they want to make sure that you know what drugs are red flags. So if a patient is taking a nitrate and they walk into your pharmacy to buy sildenafil, then they're expecting you to know that's a no-no. So the BNF advice is that combination of nitrates, they both dilate your blood vessels, and sildenafil should be avoided because it can cause very, very fatal hypotension. So it's that cumulative effect where both are actually causing hypotension. So it's quite severe. So well done. Well done, guys. Well done. Let's go on to the next one. You guys are actually smashing it. You guys are smashing it. Okay. Let's look at the next one. Number 5. We had question number 5. What did you guys get for number 5 for this one? What is the most likely reason in this patient that risperidone has been changed from tablets to a depot injection? What did you go for this question? So you receive a prescription for risperidone injections for one of your patients, right? And on the PMR, it shows that the patient takes tablets. So they just want to check to make sure that you know why the switch happened. Another area as well to know about formulations and to know why we choose certain formulations. Reduce extra pyramidal side effect, Janice. Really? Adherence. How did I get that right? Okay, just randomly. I like that, Jerry. How did I get that right randomly? But that's the thing, in the exam, you also have to just guess sometimes, and you will be lucky. You'll get some questions right that you do not even know. So always the key is never leave any question unanswered. If you have to guess, please guess. So we've got adherence. We've got improved adherence. We've got to reduce extrapyramidal side effects. I think you get more of those with injections compared to tablets. So what is the correct answer? Why are we going to change a patient from a tablet to, sorry, from a tablet to depot injections of risperidone? So you got your full answer. So the correct answer is to improve adherence. Okay, because when you take an oral tablet, it normally requires you to take it every day, right? And for most patients, taking a tablet every day is quite difficult. And so it's easier to then swap them to an injection, because with the injections, you only give them every 2 weeks or every month. So you just got to think about it this way. If you have any question in the exam and something similar has come up before, with your depot injections, mainly do that to increase adherence. It's easier for the patient to take. It doesn't reduce the risk of extrapyramidal side effects. In fact, you even have more with the injections. Great stuff. Okay, so let's look at the next one. Next question. Because they are mental health patients and they don't adhere, so you could put that down as well. So obviously with mental health patients, it's very challenging for some of them to adhere to medication. So that is quite a big thing, right? So definitely, if you have any of those questions, always think about adherence for mental health patients, how to make it easy as opposed to them having those daily medications, just so that they can stick to it. Okay, great. Very, very good. I'm loving it. Okay, next one. What's the next feedback? Question number 6. What do we have for that question? Question number 6. Which of the following medications is most appropriate for this patient's condition. So most of the time, we all learn about type 1 and type 2 diabetes mellitus. But most people ignore diabetes insipidus, which has got nothing to do with blood sugar. It's all to do with water regulation. You do not really get as many questions because majority of the questions will obviously come from diabetes mellitus. But it's important that you at least understand, and I go through this on the combo course, and I talk about diabetes insipidus and the main things you need to know. So what we got for this one? We've got challenging by Harris. Okay. That's I expect it to be challenging because it's not as common. We've got vasopressin, we've got desmopressin, vasopressin, desmopressin. But close. Deso I went for. What we got, let's see with our evidence. So the correct answer is desmopressin. So desmopressin, synthetic analog of ADH. So non-deficient in cranial diabetes insipidus, it reduces urine output because as I said, losing a lot of water. So you want to give them an antidiuretic hormone, something that stops them from losing so much water. And desmopressin. And also it's important to know about the different forms of desmopressin. So this sprays, tablets, injections. Great. So the reason why you may be asking, for those of you that put vasopressin, that's good because it's quite similar. But the reason why we're going for the most appropriate desmopressin is because vasopressin has got vasoconstrictor effects. So desmopressin is normally the preferred treatment according to the BNF. So we want to make sure that we give you answers that are backed up by NICE guidelines or by BNF so that you have the assurance that whatever you're learning is up to date. Great stuff. In your notes, Marvin, it says both. But you have to choose one, right? So this is the preference. Again, we talk about this as well in our notes when we do like how to answer GPhC questions, and we say there are certain keywords that you're going to have, right? You're going to vet keywords when it comes down to choosing, say, the most appropriate medications. So that's why I said they're quite similar. Vasopressin as well, ADH, but in terms of the preference, these two, you go for desmopressin, and that's the reason why. Okay, so let's see what's the next one. Memory trick for this. I don't have one for the differences, but I'll think about one. I'll think about a good mnemonic to help you with the differences. Vasopressin, desmopressin. Okay, let's see. Next question. Where am I? Feedback. Let's return to the feedback and question. It was this one. So question 7. Let's view the feedback. So what did you guys get for this? Because this was quite a long one. I don't even know if you had enough time to read it through. It was quite long. I think I had to give you extra seconds in this one. I don't know if you guys had enough time. So high-risk medications. For each of the following scenarios, select the most appropriate drug. Each option can be used once, more than once, blah, blah. But a 4-year-old patient has developed an annoying dry cough. So that should already start ringing a bell in your head. You're already thinking, what's going to cause a dry cough? The prescribed Ramipril 2.5 milligram capsules, already you're thinking, okay, side effects of ACE inhibitors, dry cough. He's otherwise well, but reports his daughter recently had a viral infection. So what do? Do you reassure that patient and tell them symptoms are described are likely to resolve without any intervention? Do you tell them, listen, just carry on? The annoying dry cough is going to disappear. Do you refer them back to the prescriber as they may require increased dose? That's definitely no. So process of elimination. There are always, every time you have many different options, one of the best things I do, especially when they're quite long, is rather than look for the right question, look for the wrong ones and just cross them off. Right? So you know fully well that the second one, refer the patient back to prescriber. As they may require a dose increase, you're going to go, no, cross that off. So what did you guys get for this one? So the correct answer is refer the patient back to the prescriber and switch the drug to an alternative agent. And that's because, again, your ACE inhibitors will cause a very dry cough, like you guys know. So you should refer them for an alternative. In this case, we'll probably go for an ARB. Again, sometimes you may think the dose is low, so perhaps over time, the patient may feel better. But the fact that it's developed a very dry, very annoying dry cough, and they've been taking this for 3 weeks. If you have a better alternative for that patient, again, that's what we do when we do our reviews with the patients, is you're always looking for something that's going to improve compliance. So why not try them on an ARB? So they don't have to have this cough. It's been already 3 weeks. Great stuff, great stuff. Swap them for an ARB. You guys actually got the answer. That's correct. Refer them back for an alternative. Correct. So change it, right? Sometimes some people say, oh no, just carry on and it's a common side effect and it will get better. But how would you feel if you're a patient and you're having this annoying dry cough and you've been having it for 3 weeks and the pharmacist just says to you, oh, it's going to disappear. Just keep going. When you have a safe alternative, one that will just take away that cough. Okay, great. Let's go to the next question. Next one. I think it's question number 8 now. Yes, question number 8. Let's see what we have. So again, another question that's a bit long, and it's understanding heart failure. They tend to ask you, in the combo course, I gave my GPhC predictions. Every chapter has a prediction. And we have something called the Haas formula. And the Haas formula is normally the areas that get tested in the exam from the cardiovascular system. So the most common areas. And in the Haas formula, one of the H stands for heart failure. It's a common area. So you really want to learn heart failure inside out with all your algorithms. So what did you guys go for in this one? What did you guys put down? If you know your algorithm, this should be straightforward. What did you guys put down for this question? What answer do you have? I've got digoxin. I've got hydralazine. What else have we got? Let's see your answers, lovely people. We've got ivabradine. Okay, interesting. We've got different answers, basically. All right. All those medications are indeed used for heart failure. Patient 76-year-old lady, already taking an ACE and a beta blocker. Very severe renal impairment. What does that tell you? So the correct answer, when you look, you need to learn your algorithms for hypertension, know your algorithm inside out for heart failure. You tend to ask those a lot. So, your algorithm, your first line is obviously your ACE inhibitor and your beta blocker. And then after that, you're going to move to your MRA, drugs like your spironolactones, plevinones, but spironolactone will be the next down the line. So according to NICE guidelines, if you started a patient on an ACE and still not improving, and then you add a beta blocker, and that's still not improving symptoms, then you add an MRA, such as spironolactone. So in this case, we're going to go spironolactone next. If eGFR is between 30 to 45, consider lower doses or slower titration. In this case, the eGFR is 35. So it will just be a matter of just giving them the low dose. Right? You start off with low dose and then you build it up. But yes, so some of these questions will be quite direct. You just have to learn your algorithm and you'll be fine. Okay? There's nothing tricky about this question. It's not tricky. So I did think a diuretic. So a diuretic, you don't give them all the time, Hannah. It will depend on if they have some sort of pulmonary edema. And not every single patient that has heart failure has pulmonary edema. So you wouldn't always give them a a loop diuretic, furosemide. Although majority of the time you tend to give it to them, but in this scenario, no, we wouldn't go back. If it was meant to be, say, furosemide, there will be more in that question to talk about pulmonary edema, about water in the lungs, or something to just give you a clue that we need to add a diuretic there. Great. So, Sophia, very, very good one. What is the Haas formula? Someone's asked. Does anyone remember the Haas formula? So the Haas formula is HAASS. Someone's asking what is the Haas formula. So this Haas formula, it's so powerful and it's helped so many trainees I've worked with. And all this formula does is it tells you the areas that get tested the most in the cardiovascular system. It doesn't say that, I'm not saying these are the only chapters, but they are the most common ones for you to build your foundation. So if you're going to revise the cardiovascular system, which is a high rating chapter, what I normally say is learn your Haas first. Okay. So the first H is for heart failure. Second H is for hypertension. The first A is for arrhythmias. The second A is for anticoagulants. The first S is for stroke and statin. So Jerry's got it on here. So this is a very, very good base if you want to be so good with cardiovascular questions in the exam. Majority of them come from these. And then, of course, you can learn the others, but at least always make sure that you master these ones, right, to give yourself a very good chance. Okay. So, yeah, that's good. Did we have any question there? Any other question? All right. Yes, Sophia, this is quite a good one, Sophia. Sophia says, in hospital, they start the patient on all these meds at once. Sophia, you're not wrong. You're not wrong. But here's the thing you need to be very careful about. And that's why I said, if you look at the answers, I'm referring to the BNF and to NICE guidelines. Why? Because you will be assessed on the NICE guidelines and the BNF. Different hospitals have different guidelines. So it's going to be very unfair if people were tested based on their hospital guidelines. So this may not be wrong in the hospital. You might see your patient's point, but if you read the guidelines, it always talks about optimizing first. So if you read your guidelines, it always says the same thing with blood pressure as well. Right? You normally have to optimize first, then you add another blood pressure tablet. Majority of the time, some people just start on 2 and 3. It's not wrong. It's very common practice. But you're learning to pass your exam, and the correct answers will be the answers that are in your BNF and that are in your NICE guidelines. All right. So just be careful about that. But you're not wrong. You see that in practice. But according to guidelines, you should optimize first before moving on. You shouldn't just put all of them at once. Okay. Let's go to the next one. Let's go to the next one. Question number 9. Question number 9. What is the most appropriate management for this patient? What is the most appropriate management? Sometimes when you see that word the most, it means you may have more than one plausible answer. Right? In the exam, you may have more than one plausible answer, which means it's correct in practice, but they want you to give the best. Right? They want you to give the most appropriate one. So what do you guys go for this one? Nada Juba in the house. Nada says stop warfarin and start heparin. Did anyone have anything different, or did anyone have the same thing? Janice, how are you, Janice? Janice, I know you're in the private. You're in the private. Janice, have you started using the quizzes on the private? I've really broken everything down into quiz topics, and it's really helpful. If you go through all those quizzes, I promise you, oh my gosh, you're going to smash that exam. So what have we got for this one, guys? Let's see your answers. If you don't know, just put a 0. I've got stop warfarin, start apixaban, continue warfarin. Interesting. So we've got continue warfarin, we've got stop warfarin and start apixaban, we've got stop warfarin and start heparin. This felt like a trick question. Yes, yes. But let's learn something. Let's learn something new to make sure that if this comes up, we'll be fine. Again, the questions are not going to be so straightforward. Some will be challenging. That's how the GPhC exam is. But there are also many that are very straightforward and easy. So correct answer is stop warfarin. The correct answer is stop warfarin, start sodium thiosulfate. Wow, that's interesting because I wasn't even sure about this one. I'll tell you the truth. This is interesting. This is interesting. I wasn't expecting sodium thiosulfate. Calciphylaxis are rare, so you need to know about calciphylaxis, especially with your warfarins. It's more common in patients that have got kidney diseases. That's when you tend to have calciphylaxis, which is like just forming stone. But yes, so you tend to have patients that have got kidney disease, those on dialysis, and warfarin makes it worse. Warfarin makes it worse. Now, apixaban can also increase the risk of bleeding and infection in patients with calciphylaxis. Therefore, both warfarin and apixaban should be stopped. Sodium thiosulfate is an antidote for cyanide poisoning that has been shown to be effective in treating calciphylaxis by reducing calcium deposits. It's given intravenously, usually 3 times a week dialysis. So this one, that is a challenging one, guys. This is a challenge. Even for me, this is a challenging one. This is a challenging question. I've got over 1,000 questions on here, but that is a challenging one, definitely. I would have thought sodium thiosulfate, but hey, the reasons are right there with sodium thiosulfate, and one of the reasons is simply because it is an antidote for cyanide poisoning, which I don't expect you guys to know this, but you need to have some challenging questions. And because it's an antidote for cyanide poisoning, that has been shown to treat calciphylaxis. So you probably only know this if you really know the treatment of calciphylaxis, but that's a bit advanced. Okay, Marvin, you got 100% both exams. So Abu Banda at Tamimi. Marvin, I got 100% in both exams. Wow, are you serious? No, hang on a minute. Hang on, Abu Banda, are you serious? Because if you are the first person I've ever met that's had 100% in both papers. Can you send me a message, please, Abu? Please send me a message and send me your results. Not that I don't believe you, but if that's what you got, that is so impressive. Marvin Munzer at Preregshortcuts.com. Abu, please let me know, because if you got that, we have to send you a special gift, because that is the record. We've had people have 100% calculations to 100% calculations. I've never had anyone have 100% in both papers. So is it 100% in both papers? If you did, please send me a message straight away, because we have a gift coming your way. We love to reward the trainees that just totally smash it. I don't know anyone that's had 100% both papers. That's why I'm saying this. That will literally be worth celebrating. Great. Why is the gift to be a surprise? Rubina, if you want to know what that gift is, you go for it. Get 100%, Rubina, you get one. Everyone that gets 100% in any exam, we tend to send them a gift. It's just the way it is. Okay, right. So we smashed the questions. How did you guys do on those questions? Do you want to do more? Did someone want to do MEP or something? Let me know. Do you guys want us to do a few more questions? What do you want to do? Do you want to do MEP? Do you want to do OTC? What do you want to do? I'm here for you. Abu Banda at Tamimi. Abu, please send me a message on my email. Okay, please send me a message with a screenshot of your results, because this is worth celebrating. Well done. I don't know anyone that had 100% in both papers ever. There is one more. Oh, is there? Sophie, is there one more question? Wow, let's see. Oh, yeah, there is. Oh my gosh, I'm ahead of time. Wow, there is, Sophie. Thank you. Okay. Let's go to last question. Last question was this one. A 60-year-old man reports that he's experienced severe drowsiness after. Oh, yeah, that's a good one. And I think something that's come up in the exam before. Okay, this is one that people struggle with as well. And we'll have to do some sessions on this, right? Your yellow card scheme, reporting. So what did you guys go for? 60-year-old man reports he's experiencing severe drowsiness after taking diazepam 5 mg tablets prior to dental surgery. Do not report. It's a known adverse effect anyway of diazepam to get severe drowsiness, so no need reporting. Black triangle medicine, is it? Remember, you have to eliminate those that don't sound right from the start. Delayed adverse reaction, is it delayed adverse reaction? Herbal or homeopathic medicine, is it a herbal? Serious or life-threatening reaction, is it serious or life-threatening? Suspected counterfeit, is it a suspected counterfeit reaction or defective medicine? Suspected abuse or misuse of the medicine, is that going to be abuse, having severe drowsiness from diazepam? Does that indicate that the patient has been abusing the medication? Vaccine reaction, we can cross that off because this is the vaccine. So what answer did you guys go for? Do not report, do not report. You need to know what to report and what not to report. Great, great, great. Do not report. I'm getting loads of do not report, Marvin, don't report this stuff. It is just standard. And indeed it is. Because if it's a known reaction, there's no point reporting this. If not, you guys will just be reporting every single day. You have loads going through. Loads of reports. Okay, because of common side effect, only reporting this. All right, great stuff. So we've done all 10 questions. We've done all the we're going to answer the feedback so that you know. Do you guys want to do more? Because this is going to end at 8:30. Do you want to do more? And do you want to do something else? You got it right. Well done, Jerry. Well done. Now, if you didn't pass the exam, please believe in yourself. I know so many trainees and I've worked with so many trainees that have failed the exam the first time, second time, third time, and passed the fourth time. Okay, so please don't be disheartened. It is normal. The amount of students that pass the second time or third time is quite high. Okay, so please don't lose hope. Ask yourself, where did I go wrong? Remember one thing, in order to produce a result that you've never had, you need to be prepared to do something you've never done. And I've got a formula for you to help you. And it's called test yourself when you're reading any subject, use a lot of quizzes, use a lot of active recall. What do you guys want to do? What do you guys, more, what do you want me to give you? More of what? You want to do more of clinical? You want to do more of MEP? You want to do more of OTC? What do we get? Hannah says, I missed the pass. Oh, Hannah. Oh, Hannah. Hannah, that's heartbreaking. I missed the pass mark by 1 mark. I missed the pass by 1 mark on maths paper. Hannah, you will pass next time. All right. And just think, Hannah, that if you had to look at that paper again, I promise you that there will be questions that you may have got wrong that you totally knew the answer. It was probably just a minor error that you did. Maybe you missed the decimal place. Maybe you had that extra 0. Maybe you were nervous. Maybe you ran out of time. But whatever it is, you had the ability to pass. So please just put yourself together and just believe and just say to yourself, next time I will be different. Next time I'm going to do something different this time, so that when I do the exam next time, I'm going to produce a whole new result. And that could just be what I'm showing you. It could just be practicing more questions. It could be using time, doing other time conditions like this. It could be joining a course. It could be joining Preregshortcuts. It could be getting the question bank. It could be getting mocks, doing more mock papers. It could be working with a group of friends. But all you have to say to yourself is, in order to produce a new result, there is something new that I have to do. There's something new you have to do, and that will be the answer. Okay, great stuff. We have COGS, please. Wow, COGS, more COGS, clinical. Yes, COGS. Okay, so I'm not a COGS person. I'll tell you straight away. I don't teach COGS. That is Georgina and Uma's area. But I'm going to give you the COGS because we also have the breakdown, the workings. So I'm going to use that. Please don't ask me any questions on the COGS because I'm not going to know. But let's try. You guys want to do COGS questions? So COGS are normally 3 minutes. So perhaps we'll just do one and we'll see how we get on. Is that okay? Type of 1 if that's okay. Bring on the COGS. Have you all got calculators? You all got GPhC calculators with you? So this is the good thing about this system. That's why Uma has been working behind the scenes to put this system together for you. It's different from what you see anywhere else. right? That's why we can just jump around. We don't need to sit down and do loads of slides on clinical, and then next week I'm going to do loads of slides on MEP, and I'm going to do some slides and present to you. No, we can just have one day. We just get on here, you tell me what you want, and we have that flexibility. So we're going to go calculations. We're going to choose one calculation question. We're going to give you 3 minutes. Let's go one number of questions. One, we're going to go 3 minutes because that's realistic. Are we ready for calculations? Type of one, type of one, type of one. If you are ready to smash the calculations. I know what's going to happen. And a very easy question is going to come up now, right? You guys will be like, that's too easy, Marvin. C1V1. Okay, let's start. Please enter at least 5 questions. It wants me to enter at least 5 questions. That's 15 minutes. No way. Okay, let's just do 5 questions, but we're not going to do all 5. Okay, let's go. Let's do this. Question number 1. And you have 3 minutes. And I'm going to move to the next question. So I'm looking at the timer. Please look at the timer. When it gets to 12, I'll change it to a second question. Oh, it's got an extract. Oh, sorry, guys, because I can't. I can show you the extracts, but then it's going to affect the questions. You won't be able to. Oh, sorry. I'm going to change this one. Sorry about that. Let me change this. I cannot give you guys extra questions. We'll have a separate session just on extra questions. Let's do this one. Okay, are you guys done? If you are, type a 1 if you're done and you're ready for the answers. Type a 1. If you're not done yet, type a 0. If you need more time, type a 0. But if you're done, type a 1. So I think we're going to go through the answers. Let me just put something. This is another question. Next one, I'll just put this 0 so that we can get through. And next one, another SPC. We have loads of SPC questions, getting more and more of these in the exam. All right, you guys ready for the answers? Okay. Yes, let's look at your answers. What did you guys get for the first answer? Just put your answers down for the first one and the second one. Just type in your answer for question number 1, because we've literally done 2 questions. For the 2 questions, put your answers down. And how did you find it? Was it straightforward? Was it easy? Was it tough? Was it okay? So we've had many trainees that did the exam in June. You can see that on the reviews, right? They are many trainees that actually said, yes, this is quite similar, and the mock as well. Okay, so let's look at the answers on there. I'll just show you the answers because I don't know calculations. I can't go through the whole explanations, but at least you see, and it's got explanations. So the first one was question 1. I think that was what we did. Review answers. It's asking me to review my answer unanswered. Why is it doing that? Sorry, let me just put 21. Let's submit this, submit the answers, then it's going to sort it out. Okay, so as you can see, I got all wrong. So let's get the first one, view the feedback. What did you guys, oh no, that was the SPC question, sorry. So we went to number 2, yes, with the inhalers. What did you guys get for the inhaler? What did you get? What did you get for your inhaler? I've got 140. What did you guys get for the inhaler question? Yes, it was question 2. It was question 2, Robina. It was definitely with the inhalers. Okay, so I'm getting 1. I'm getting 1. So this was question 2. Let's see the feedback. So the correct answer is 2 inhalers, 2 puffs per day times 6 weeks, because the patient, it did say 6 weeks. That's correct. So you have 2 puffs per day, which is twice daily. So 2 puffs a day. You're taking that for 6 weeks, about 6 weeks times 7 days, right? Because yes, each week is 7 days. That will give you 84 puffs. Now we know that you've got 120 doses. So 84 puffs is 1 inhaler. But remember that the question actually says she requires enough inhalers to cover this period and requests an additional spare inhaler, which is probably what you guys missed out. So those of you that put 1 inhaler, you're correct in terms of your calculation. I don't doubt you're correct. The only thing is the question is asking how many inhalers, because this person also requests an additional spare inhaler. That's tricky, isn't it? That's quite tricky. Miss the additional. Yes, that is quite tricky, isn't it? That is quite tricky, but smart. Yes. Okay, great stuff. But at least that's clear. If you got 1 inhaler correct, you know the technique, you worked that out right, you just missed something, which happens a lot in questions. And that's what I'm saying in the exam. Most of the times when you get something wrong in the exam, and that's what I was just explaining to Hannah, most of the time in the exam, when you get something wrong, it's not because you didn't know the stuff. Most of you will just look that you didn't see something, you misread something. And that should also give you some confidence to know, okay, hang on a minute. Maybe I failed, but it wasn't because it was tough. I just misread a few things, but under normal circumstances, I know this stuff. Okay, so the next one, what was the next question? Let's see. I can't even remember which one was the next one. So we did number 2. Yeah, we did number 3. We did number 3. So what do you guys get for number 3? Those of you that finished the question. Yeah, so take that on board. Hannah, definitely, right? And that's what I always say to all of you. All of you have the ability to pass. You all have what it takes to succeed, and you've gone through university. So the question has never been your ability. It's never been, can you pass the exam? It's always been, will you? And it's always a case of motivation and just preparation, looking out for those little things that you've missed out. Okay, great. So I'm getting 13.1, 13.1, 15. 13.1, 15. Wow. 1 decimal place. Okay, so we should have him like 15.0 really. Okay, lots of 13.1s. And let's see what the correct answer is. Correct if you put 13.1. So if you didn't get 13.1, that's the working for you. Those in tablets times F. That's the working. Right? That's the working. That's straightforward. That's the working for you. But the final answer is 13.1 because you want to give that in decimal places. How many of you enjoyed this session? If you enjoyed it, type of me, type of me, type of me, type of me, type of me. Type of me if you thought, wow, that was okay, that's useful. We could do more of these where we just literally come here together and we just go through clinical, we go through calculations, we go through MEP, we go through OTC, right? It's no problem at all. If you guys wanted the question bank, the good news is you could actually buy the question bank on its own if you wanted to, right, from Preregshortcuts. And now we have something that no other person has, and that's with Klarna. No other provider has a 12-month installment plan. So most people just have the regular 3 months from Klarna, which is given to everyone. But we now have a 12-month installment plan, which means if you wanted to, you could buy this question bank and literally pay £25 a month, as small as literally £25 a month for the next 12 months. And you have access to the entire question bank, and you could practice all of these questions. And it's a very good way of learning. Okay, it's all about questions. It's all about questions. Practice questions every single day. All right, that's what it is. This exam is a numbers game. It's a numbers game. That means the more questions you do, the higher chance you have of passing. And the GPhC tends to repeat questions, or at least they ask similar areas. So all you have to do is keep practicing. And I know some of you on my private program. My private program is all about quizzes. It's about quizzing you, test questions. So I would definitely recommend that you look into getting the question bank, simply because you could pay £25 a month for the next 12 months. It wouldn't make much to your bank balance, but it would transform everything for you because it's going to help you pass, and it's going to be an investment, and you become this amazing pharmacist. But you have over 1,000 questions, and as you can see, it's so easy. You just literally go on there and you choose whatever you want and you practice. You go for low weighting, high weighting, everything is on there. You also have all the answers, so it's not like you have A is correct and that's it. It has the rationale, and all the rationales have references to the BNF or to NICE guidelines, just to give you that confidence that everything's up to date. Okay, so look into it as just an advice for you. You don't have to get the question bank, but if you're serious about practicing questions with answers on a daily basis, which is what all of you should be doing. So the foundation of your revision, if you're doing the exam in November, is continue to practice questions. If someone asked me, Marvin, what's the secret to pass calculations? Keep answering questions, keep practicing questions like we've done today under time conditions. Time yourself 1 minute, 3 minutes, 1 minute, 3 minutes, 1 minute, 3 minutes. Even if you're just doing one question, time yourself. Always keep doing this. And within the next few months, you're going to notice how confident you are, how quick you are at answering questions, because this exam is also a test of speed. People don't talk about this, but it's not just a test of knowledge. It's also a test of speed. And so when it comes down to SPCs, we have loads of SPC questions on this question bank. Like you guys saw, I had to actually skip some of them because we couldn't open them up for you to do. But we could have a separate session just on SPC questions, and then I'll probably post the link in the chat, and then you guys can open it and do it that way. Okay, thank you all so much. Do you guys have any questions before I disappear? It's been great fun. Again, I'm going to do more of this if you guys want. Spread the word. I'll set something up and we just turn up here and we just go for it, guys. We just literally go for it. Muthado Al-Fahad, where to find the workbooks? So the workbooks we published at the end of this month. This is something new to Preregshortcuts. We now have workbooks for every single part of the exam. So you're going to have workbooks for OTC, workbooks, calculations. And guys, let me just say this. When I say workbooks, I'm not talking about this random workbooks that you see from providers. It's not just black and white, boring, random workbooks. These workbooks are detailed. And they're all free if you're on the course. You guys will be shocked when you see the quality of the workbooks. And the workbooks go through things in detail. It has questions, it has scenarios. It's also aligned to the GPhC framework. Because this year, with Preregshortcuts, we have a training plan that has been approved by the GPhC. And one of the things you need to do to show that you have a plan that's approved, you have to match your plan to the learning outcomes, right? To the learning outcomes. You got 55 learning outcomes, 21 assessment activities, but you need to match those. So our workbooks are matched to your learning outcomes. You can actually see what everything relates to. So it's incredible. I'm going to do a session. I'm going to show you guys. By the end of this month, the workbooks will be published on the website. So most of them for asking at the end of this month, we're just reviewing them at the moment to make sure that they're crisp, to make sure they're all up to date, that they're so good for you. Everything. It's really like so much work has gone into the workbooks. And I know for a fact that the moment Preregshortcuts puts this out there, everyone is going to copy it. Everyone is going to copy the Preregshortcuts workbook, because that's what people do. They just copy us. But yes, once we put it out there, end of this month, just wait for end of August, Muthada, you're going to have that and you're going to love it. We're also going to have a plan for you as well, a revision plan. I already have that, a checklist. So you're able to have a very good structure, because failing to plan is planning to fail, right? Failing to plan is planning to fail. Can we buy the question bank for a few months? We don't have them like installments, like 1 month or 2 months. We just have them as you could spread the payment. So it's just a fixed price, Ray, because Ray's asking, can we buy them per month? Unfortunately, we don't have them as a subscription model where it's like subscribe for 1 month, for 2 months. Perhaps we may have that in the future. But right now, it's just a fixed price. And you have an installment option where you could spread that payment in 12 months. Did you say the workbooks will be free if you're on the course? Yes. So for everyone that's on the course, the workbooks will be free. You'll be able to download them. And when you see the workbooks, you're going to go, oh my God, is this stuff free, Marvin? Are you serious? Because it's every single chapter of the BNF. It's OTC, it's MEP, it's calculations. And they're that thick. They're like really, oh gosh, they're so good. So much work has gone into these books. They're going to help you so much. Is the revision plan for November sitting? So the revision plan, no, it's literally for anyone that is doing the exam. So for any of you that's interested, if you're struggling with clinical and you want to practice so many questions with me, like quiz questions, then I've got a website. Let me show you. But this website is just for quizzing. Okay, so I'm just talking about if you want to practice testing yourself like we've done, because I'm all about testing and have feedback, and I test you intensely on every single area of the GPhC exam, the most key areas. I've literally structured everything on this website, not this one. I've got another one. Let me see. I might be able to show you guys. Let's see if I can bring that up. Let me see. So this is for anyone that is struggling with clinical, that wants to become really good. And if you want to really practice, like practice clinical quizzing with myself, then you could check this out. You could really, you could check this out. So how do I share this? So I have a club called a BNF club, and I've actually added calculations on there. As you can see, I have a lot coming up on this club. It's a BNF club. How to pass the GPhC exam, common GPhC topics. But what I was going to show you is the way I've broken things down. So if you see here, you have loads of quizzes on everything. These are loads. So it's broken down to your high rating. So you can see nitrate quiz, amiodarone quiz. So when you're learning, rather than reading notes, you're just quizzing yourself. DOAX quiz, you go into DOAX. How should apixaban be taken? Twice a day. How should doxaban and rivaroxaban be taken? So it's just like that. It's straightforward, but the quizzes that if you go through compared to reading notes, and I have that for everything, like all the key areas that get tested. I even have a separate section that is just on your high-risk drug quizzes. So you could see quizzes on opioids. These are all high-risk quiz on opioids, sodium valproate, methotrexate, NSAIDs, but it's just made easy. NTI, neurotherapeutic drugs, parenteral drugs that come up in your exam, high rating, anti-diabetic drug quizzes. So loads and loads and loads, but it's all about quizzing. And then we've got pediatrics, which makes up 20% of your exam. So these are all pediatric areas that get tested in the exam. And then we have like another one, which is just like your high rated other areas, apart from the therapeutic ones, but high rating other areas. So you have mnemonics, medical emergency, ranges and diagnostic. These are all high rating. Counseling quizzes, so your counseling points, red flags quizzes, just some red flags. It's so much, but it's so good. Like literally, it's easy for you to just go through this as opposed to like reading a million notes. You're just testing yourself. You're literally testing. So ask a question, answer, question, answer, question, answer, question, answer. But yeah, so this is normally a very small group. We don't have many people because it's really small. But it's just for anyone who wants to be better at clinical. We also have calculations videos and 2 calculations mocks from Georgina, but it's for anyone that is really struggling or you just want to be good, right? So if that's you, then hey, by all means, you can send me an email as well, Marvin, or you just check out the site. So it's marvin@preregshortcuts.com. You can send me an email if you want, or you just check out the site and see if you like it. And yeah, so let me let you guys have a great evening. And please just keep an eye. I'll be posting and I'll do more sessions like this. It's easy for me to do. And I'm trying to do something different for you. All right. And we have a lot of good things for you. And they're totally different. The more do you guys like this, by the way? How many of you did you guys like this? Did you find this good, interactive? Did you like the sort of sessions? Those of you that are doing revision, would you like to do more of these? Perhaps more clinical, more calculations, timing you, going through the answers together on a sort of regular basis? If you like it, type on me, type on me, type on me. Great. So thank you, Hannah. Thank you for your feedback. Really appreciate it. I'm going on holiday tomorrow. I'm going to sunny Turkey to get a tan. Yes, I'll be in Turkey tomorrow for about 12 days, 10 days, about 10 days in Turkey. But as soon as I come back, I'm going to do more sessions with you. Perhaps I might do 1 or 2 sessions over there with the question bank so that at least I could get you guys in the flow before your exams. All right. Take care. Stay positive. Thank you so much for your time. Believe in yourself. You can do this. You were born to succeed. All right. Take care, everyone. See you soon. Bye.